Let's talk about the reasons you're here. There are lots of common stories about facial and neck pain. You have chronic headaches that just keep getting worse, or you have soreness in your jaw, your neck, or your back, or your bite has changed. You wake up with headaches or with soreness in your jaw joint. You can't open your mouth as far as you used to. You're uncomfortable chewing. Your jaw pops and clicks. Your bite seems high on one side, and your teeth just aren't meeting evenly anymore. Anything communicated is, have I covered a symptom that you might have? So basically, it isn't the teeth. There's a muscle and nerve system that's attached to the jaw that just isn't working. As a matter of fact, the muscle and nerve system is also attached to the neck, and that whole complex just isn't working the way it used to. Well, how did you get that? Well, you got that as a result of trauma of some kind. You may not remember it, but it may have been an auto accident, may have suffered a blow to your head, or it could have even been birth trauma, but something occurred to throw things out of whack. And what occurred then was that little fibers broke, and those fibers were replaced with scar tissue. And scar tissue is the basic problem. Let's look at it this way. All right, let's think about your driving. Okay, you're driving a car, and you pick up a nail. Let's say the nail is in your right front tire. Okay, so you pick up the nail, and what happens? Do you notice you picked up a nail right away? No, not usually. The nail will go into the tire, and then there'll be a slow leak. And so that leak is barely noticeable. Then you lose more and more air, and that tire gets flatter and flatter. Well, then you're fighting with the steering wheel, and the flatter it gets, the more you fight. And you say, "Gee, why is that car pulling? Why is that tire, or why is the car pulling to the right?" And then finally, you work so hard. Well, then you get out and you take a look at it, and you say, "Oh, the tire's flat." Sometimes that tire is more than flat. Sometimes you've driven on that flat tire so long that the wheel is destroyed. Well, what about your head and neck? Well, your head and neck isn't exactly like a tire, is it? But you can have that kind of damage occur. We suffer that blow to the head, blow to the neck, go through whatever trauma we go through, and we wait for it to heal. And we think it will heal. But it doesn't. Or at least it doesn't completely, and heals up that scar tissue. And scar tissue doesn't bend. It's not flexible like ordinary tissue is. Now your muscles are fighting. Your muscles are fighting to keep your head in the right position. They're fighting to keep your jaw closing smoothly. They're fighting to keep your neck correct. They keep on fighting as the muscles are pulling. And when the muscles are pulling, those nerve impulses that cause those muscles to pull in the right direction, they keep on firing, and they're firing more until the nerve itself becomes overloaded. Well, that nerve is called the trigeminal nerve. Okay, it's a nerve that goes along the side of the face, and there's a whole trigeminal complex that communicates. Trigeminal complex includes nerves going to the muscles and to the teeth of both the head and the neck. And so the same nerve that affects that neck, that affects the head, also affects the teeth. That's why the teeth feel like they're out of whack. They're really not out of whack, but the teeth themselves are sending signals to that entire nerve complex. It's an interesting phenomenon. But because there is damage to the neck, but because there's damage to the jaw, and because the teeth may not line up properly, we need to approach this problem in a multiple fashion. Because here's the point. Your nerves have been overloaded. And they got overloaded to the point where they just said, stop! And they stop. For you, the stop is a headache or a jaw ache or a migraine. That's what's going on. That's how your body says stop. That's how it finally cries for help. So it's our job to decipher this problem, to see where this problem is coming from, and gradually and consistently walk the problem back until your muscles and that trigeminal nerve are no longer overloaded. And if we can, we'll get back to that original scar tissue and maybe get that scar tissue to heal completely. Wouldn't that be great? How do we do that? By releasing as many forms of stress from your head and neck. Work with the scar tissue and get your head and neck working properly again. But remember, it took a long time for you to get here, and it'll take some time to get back. And how far we get back depends upon your capacity to heal and how much work you do to get yourself back. See, we can't do it all. But we'll work with you in several ways to do it. Here's some of the technologies we'll use. Ultrasound. Ultrasound breaks up scar tissue. And when the tissue is dissolved, it has a chance to reheal. And hopefully it'll reheal in a better position. It usually does. We'll use the cold laser. Cold laser provides laser therapy, not to cut. There are cold lasers that are there specifically for pain control. And they also stimulate your immune system to help you heal. There's trigger point therapy. There are trigger points all over the body. And a trigger point means that a muscle in one place will stimulate pain in another. For example, here's a common problem we have. We have trigger points in this muscle right here. And the trigger points, when stimulated here, will produce a headache right here. So we'll work with you to neutralize those trigger points. Darn it!